Hi, I'm Daniel Lucas, and welcome to Abstract Essay. Abstract Essay is where ideas take shape, thought find depth, and every conversation explores the art of thinking beyond the obvious. And today I have my special guest, and we are talking about the 300 billion healthcare blind spot uncovering hidden ways. No other than Mr. Donovan Pyle.
Daniel, it's great to be here with you today.
Welcome to Abstract Essay, Mr. Donovan, and can you please introduce more about yourself?
Absolutely. My name's Donovan Pyle. I'm the CEO and founder of Health Compass Consulting, which is a management consulting firm in Orlando, Florida. I'm the author of a book called Fixing Healthcare: How Executives Can Save Their People, Their Business, and the Economy. And I'm a senior advisor at the Validation Institute in Boston. Good to see you.
Mr. Donovan Pyle, thank you so much for sharing your knowledge and wisdom to the world. What exactly constitutes this $300 billion healthcare blind spot, and what kinds of ways are we talking about?
Sure. So, the thesis for my book is that the reason that 25% of what Americans spend on healthcare is considered waste is that they don't get objective, unbiased advice on how to purchase healthcare. And that leads to all kinds of challenges downstream in the supply chain.
Why has this massive amount of waste remain largely invisible to healthcare system and patients?
That's a great question. So just to level set for your audience on the healthcare landscape in America, the U.S. spends about just over $4 trillion a year on healthcare, and about 40-something% of Americans get their healthcare coverage and benefits through their employer. And that's really the area that I specialize and live in, is in what we call employer-sponsored coverage. And so employers cover 164 million Americans, and they spend about $1.3 trillion a year doing that. And unbeknownst to many of them, they waste 25% of that. And if you break that down to the employee level, that equals roughly $4,000 per employee per year in waste. So when you think about the fact that I think the average American makes about $60,000 a year, you consider that if we're wasting $4,000 per employee per year in what could be compensation for them, that's a huge opportunity. And so I wrote the book to really highlight this opportunity and what I see as the biggest constraint and reason as to why it exists.
What percentage of healthcare spending does these represent, and how does it compare to other industries?
So, for businesses, it's often the case that healthcare is a top 3 expense, usually their second largest expense behind payroll. And not only that, it has become what's often the fastest growing financial risk on corporate profit and loss statements. And so we're in a place where, right now, I think in 2024's numbers, the average cost of insuring a family of 4 was something around $35,000.
Wow.
Yeah, so if you just take a step back and think about, wow, I mean, employers, would you rather buy a brand new Toyota Camry for your employees every year, or put them on this health plan, which frankly most of them don't even like? And the proof, the last nail in the coffin, as far as I'm concerned, is that medical debt is the number one reason for bankruptcy in the country. And amazingly, the vast majority of those who file for bankruptcy due to medical debt, they have health insurance. So it's not doing what it's supposed to be and intended to do. And so I think it's really a function of because employers, the people that make decisions around how they finance and procure healthcare for their employees, they don't understand this landscape. They don't understand who does what and why. And the people that they generally rely on for recommendations in this area actually have very little incentive to help them maximize the return on their healthcare investments. In fact, they make more money when costs go up, not down. And so that's really the conflict of interest that I really want to shine a spotlight on.
Well, Mr. Donovan, interesting indeed, interesting facts, root causes, and systemic issues. Is this primarily a problem in inefficiency, misaligned incentives, or outdated systems?
Yeah, good question. So I think what's really instructive is to have some clarity on how this industry came to be, how health insurance came to be in the United States. And so in my book, we have a chapter that goes over the history of how these things happen. I mean, we tend to think that these systems and structures that they've just been around forever and it's always the way it's always been done. But in reality, health insurance has only been around for 90 years. Okay. It's a relatively new phenomenon. It's a new product, and it doesn't have to be that way. So I think what's really fascinating for especially people that are a little bit more business minded is to understand the history, because there's some lessons to be learned here. So I'll give you just a quick overview, if you don't mind.
Go ahead.
So, in the year 1900, the average American spent more on cosmetics than they did on healthcare. They spent about $5 a year on healthcare. That equaled about 1% of their total income. And the reason for that was that, back in the year 1900, medical professionals they weren't able to cure much. There wasn't really anything they could do. So hospitals were, mostly a place where the indigent went to go and die. And the best that many clinicians could do back in those days was help them feel comfortable in their last days. And so with the dawn of medical advancements, as doctors started having better training and technology around MRIs and vaccines and all these things started happening in the 1920s, medical care started becoming much more expensive. And so what ended up happening with these hospitals was that, while they were able to actually start curing people, and this was a new concept that they could actually start curing people, the problem was that many of their patients couldn't afford to pay their services, and their cost basis was going up. So Baylor University Hospital in Dallas, Texas, had an idea. What if we partnered with a large employer and had these employees prepay for our services? How would that help stabilize our revenue as a hospital? And so that's what they did. They ended up partnering with Dallas Teachers Union, and they charged the teachers 50 cents per employee per month so that their teachers could go to this nice clean hospital at Baylor and have their babies. And that became the first Blue Cross plan. All right.
Nice.
And what happened in the next 10 years is that hospitals from around the country, they saw the success of Baylor University Hospital and this partnership with the teachers union. They said, wow, we would love to create our own versions of Blue Cross plans in our own region. so that we could stabilize our revenue as well. And so what ended up happening, this is the really fascinating part, is that these hospitals actually put up the money. They invested money to create health insurers. And over the next 10 years, by 1940, there were 14 other Blue Cross plans that popped up around the country.
Interesting history, Mr. Donovan, and thank you so much for sharing to the world.
Sure. So the reason I think that's relevant today is that, in today's environment, we tend to think of hospitals and health insurers sitting on opposite sides of the table. And, in the news, you'll see that there's this public fight every couple of years between a hospital and an insurer about network contract rates. And at the end of the day, that's actually a lot of smoke and mirrors, because at the end of the day, both hospitals and health insurers benefit from rising prices. They both benefit when it comes to employer-sponsored healthcare. They both benefit from rising prices, and there's a lot of reasons behind that. Lots of them are regulatory. There's a lot of unintended consequences from some regulations that have happened over the past 15 years. But it's important to know that, if you're a CFO at a company and you're trying to maximize the return on your benefits investment, you're trying to fulfill your fiduciary responsibilities, then you have to understand this landscape. You have to understand these dynamics. And that was really the genesis for writing the book.
And, well, looking forward for people will read it and they will empower for sure. And let's talk about the financial and practical impacts. How does this hidden waste directly impact what patients pay for healthcare?
Yeah, absolutely. So one of the things that, we always try to educate employers on is that at the end of the day, it's the employer and their employees that pay for healthcare. In today's environment, health insurers, ironically, take on very little risk at all. They don't pay for anything. It's the employer and the employees and their families that pay for the hospitalizations, the surgeries, the labs, the imaging, the drugs. It's employers that pay for all that stuff. And so the question becomes, how much are you actually paying for hospitalizations, surgeries, labs, imaging, and drugs? And amazingly, in the current environment, most employers don't have the clarity and visibility to even answer that question. They can tell you how much they spend on office supplies. They can tell you how much they spend on, the cost of goods that they make, down to the penny. But when it comes to their second largest expense, in many cases, they don't know how much they're spending for specialty medications, how much they're spending on total knee replacements. They just don't have the clarity. And so, the old adage is you can't manage what you can't see and what you can't measure. So what we try to do is put them in a position where they can actually measure these things and have clarity into their supply chain. And that allows them to actually save money, reduce costs by improving coverage and care for employees who, frankly, let's face it, a lot of employees in today's environment, they are avoiding care that in many cases they need because they're afraid of what things are going to cost. They don't know, or they don't have enough in savings to even use their health plan. And so that's a real shame. And when you look at the rates of chronic diseases in this country, it's not a good trajectory. We need to address these chronic diseases. The cost of managing someone's diabetes is about $8,000 a year, and that's not prohibitive. But the cost of someone's diabetes getting out of hand is that they end up in the hospital for 4 or 5 days with a $50,000 to $70,000 healthcare claim. Right? Not only that,
Yes.
they lost a week of work. Right? They weren't able to take care of their family that week. There's all kinds of downstream effects from avoiding care that you need. pertaining to your chronic diseases.
Mr. Donovan, how can AI and data analytics help identify these blind spots in healthcare systems?
Yeah, I mean, I think, and again, I'm certainly no expert in in AI, but I think like most industries, there's going to be endless use cases for artificial intelligence, and so I think there's lots of efficiencies that can be made on the hospital side with clinicians, so that, like all of us, AI is going to potentially put us in a place where we can stop having to do the work that is low value,
Yes.
and really work to our highest value. I think that's really probably the aspiration for AI technologies in general. But you got to look at the financial incentives. Do hospitals really want to reduce their cost basis? They don't really care. They just don't really care. In fact, many of them don't even do true cost-based accounting, so they don't even know what their costs of goods are. Um, but I would say yes, there are absolutely lots of applications for AI on the supply side, but also to help employers navigate their claims data and understand what inefficiencies are in the market. So, just for example, I'm here in Orlando, Florida, and we have two major health systems in town. If you're an employer using a traditional network in Orlando, Florida, one of the health systems charges about 3.5 times what Medicare pays. 3.5 times for the same exact services done by the same people at the same place. The other health system charges about 2.8 times what Medicare pays, right? So about 25, 30% less. Now, here's the rub, though. The hospital that charges less on average in most clinical categories has better outcomes for their patients. So it's a higher value service. It's a better performing health system. And a lot of employers don't know that. They don't have the tools and insights to see that. So I think there's absolutely applications. I mean, we can give people a dump truck of data, but getting, gleaning actionable insights from that data, that's a whole other animal, right? So
Yes.
my hope is that certainly AI can help facilitate better insights and better responses. Another interesting thing about, just here in Central Florida, and this is true in many regions, is that the price variance of healthcare is over 1,000% here in Central Florida. We've got employees who are going to a hospital and getting MRIs for $6,000 a pop, when they can literally go down the street and get the same MRI for $600. The problem is that they don't know that. They don't have visibility into pricing. And so that's why a lot of this waste persists. Employers rely on benefits brokers to maximize the return on their benefits investments. That's what they expect them to do. But brokers work for insurance companies. They're distribution partners for insurance companies. So they're not in the business of helping employers really find these opportunities and take advantage of them.
What's one simple change that could immediately reduce waste without compromising care?
Yeah, absolutely. So the prerequisite so just to back up, many of these strategies and solutions that we need to solve a lot of our healthcare woes in this country, we're not going to solve all of them. We never will. There's always going to be pain points, right? I mean, in every market, no market's perfectly efficient. But a lot of the strategies and solutions that we need are in the market already. The problem is that most of them don't see the light of day because Again, employers rely on benefits brokers, and brokers work for insurance companies. They're not in the business. They're not financially aligned to help employers take advantage of these strategies and solutions that can really eliminate a lot of that waste. So getting unbiased advice is the first thing. It's a non-negotiable. In fact, as if for anyone here is a fiduciary at their business, if you're a CFO, you're an HR director, you're a CEO, you're listening, you are probably a fiduciary on your company's health and welfare plan. And that means you have to get unbiased advice in this area, because you're probably not an expert in these things. You probably don't know anything about it. And that's not your fault. You didn't get into that business to provide healthcare benefits to your employees. Just like I didn't start my business to do accounting for my firm. That's not why I got in business. I hired an accountant. The difference, though, is that when I hire an accountant, the accountant works for me. They're not getting paid by the IRS behind my back. And that's really the difference in the benefit space, is that brokers work for insurance companies. They get paid bonuses by insurance companies for meeting certain thresholds of business revenue generation. So that's unbiased advice is the first thing. Secondly, once you get unbiased advice, okay, now you're going to be exposed to a whole new world of strategies and solutions that you've probably never seen before. And this can be kind of daunting, and that's natural. So, this is where high quality consulting really matters, where, the consultant really should have a formal process for understanding you as an employer and your population, your unique needs, your business objectives, yada, yada, and be making strategic recommendations on which products, which strategies to execute, right?
Yes.
What to actually do. and so that's really the path that employers need to take to gain these efficiencies, improve the financial and physical health of their organization, and build a more valuable business.
Mr. Donovan, before we wrap up our discussion for today, I'm inviting you to please listen to my other podcast, people. My other podcast, because my abstract essay is already in 5th season, abstract poetry in 2nd season, and my book 101 review in 5th season too, comedy 101 2nd season, and my food 101 in 5th season as well, geography 101 in 4th season, and my baby podcast law 101 and mental health 101, love letters in 3rd season, and movie 101 review and music 101 in 8th 4th season, and science 101 and sex 101 in its 1st season. Please listen to them wherever you listen your podcast. So, Mr. Donovan, if you could implement one systemic change tomorrow, what have the biggest impact?
Sure. So, I mean, there are things that we could do on the regulatory front, which that's hard. That's really hard to do. So I would say there's a simple thing you can do as an employer, or even as an employee, to really start to make a difference and get the ball rolling. And I would go to fixinghealthcare.com. The website's going to be up in a few weeks as we get ready to launch the book. But there you will be able to take a quick assessment. It takes about 3 minutes, and you'll get clarity on where the opportunities are in your organization's health and welfare plans, so that you can start improving the financial and physical health of your organization in a very real way. So I would say clarity is the first step, and that yields actions.
Mr. Donovan Pyle, thank you so much for sharing your knowledge and wisdom to the world. So can you please invite our listeners to support your advocacy, your books, or whatever projects that you're doing right now? Mr. Donovan?
I'm sorry, what's the question?
Can you please invite our listeners to support your advocacy or any projects that you're doing right now?
Sure. Like I said, my book, Fixing Healthcare, will be out later in 2025, probably in November. And I encourage you to go to fixinghealthcare.com, get on the wait list. We'll send you a free executive summary of the book and some other goodies as well. So, yeah, check that out, fixinghealthcare.com, and look forward to seeing you there.
Yes, people, let's support Mr. Donovan Pyle, because if you support him, for sure, more and more and more empowering books like this to come. Mr. Donovan, thank you so much for your time.
Great seeing you, Daniel. Thank you.
More to come, people. See you soon.